Before I begin, I have a question for all of you. Did you know that 20 people each day die waiting for an organ donation? That is 20 people each day that are waiting for somebody to help save their life. Have you ever dreamed of being somebody's hero? Have you ever tried to think of ways that you could be a hero without being a superhero? Today is the day that I present you with a way to do just that. Organ donation is something that is oftentimes overlooked, but is important for some people to survive. It would be such an amazing feeling to be able to save somebody's life, stranger or not. According to organdonor.gov, every 10 minutes someone is added to the donation waiting list. That means every 10 minutes someone is in need of your help. The website also states that 95% of U.S. adults support organ donation, but only 54% of those people are actually signed up to be a donor. Today I'm going to expand your knowledge about organ donation by going over the process of becoming a donor, the process of organ donation, and what happens after the donation. Becoming a donor is a very personal choice you have to make. In 2016 alone, 41,335 organs were donated. You can either be a living donor or you can have your organs donated after you pass away. Most often, organs donors are deceased. About 6 out of 10 donors are deceased and 4 out of 10 are living. A deceased donor can donate both kidneys, both lungs, their liver, heart, intestines, and pancreas. A living donor can donate one kidney, a lung, or a portion of their liver, pancreas, or intestine. The process to become a living donor can be long. You have to go through a number of steps. First, you will have to contact the transplant center of your choice. Once you get in touch with them, they will get your consent to start a basic medical screening. Potential living donors are evaluated by the transplant center to ensure that they are a suitable donor. They will ask you questions about your medical history. After the initial screening, typically a blood test will be done. The staff will begin a psychosocial and medical evaluation. They do a number of different tests, including a chest x-ray, an EKG, a urine test, a radiologic testing to view the organ you want to donate, and some more blood tests. They perform these evaluations to make sure that no adverse outcomes will occur during any stage of the donation. Once you are done with the testing, you are given the okay and you will be matched with a recipient if you do not have a specific person you want to donate to. Typically, a living donor should be in good health, between the ages of 18 and 60, and not have or have ever had diabetes, cancer, high blood pressure, kidney disease, or heart disease. As with any major surgical procedure, the risks must be taken into consideration. It is said that a small percentage of patients have had problems maintaining life, disability, or even medical insurance coverage at the same rate as before the surgery. There can also be financial concerns due to the delay in returning to work if there are any unforeseen medical problems. In order to match organs to patients on the waiting list, many factors are taken into consideration. Some of them are blood type, body size, distance between the donor's hospital and the patient's hospital, how long the patient has been waiting, the severity of the patient's medical condition, and whether or not the patient is available to receive the transplant. Some factors become more important depending on the organ. For example, some organs are able to survive longer outside of the body than others. The Organ Procurement and Transplantation Network operate a national database of all the patients who are in the United States who are on the waiting list. Their system also matches donors to potential recipients. The kidney is the most common organ that is donated. The identification for potential recipients for a donor kidney includes the common elements mentioned earlier and some other factors, including a negative lymphocytotoxic cross-match and the number of HLA antigens in common between the donor and recipient. Many kidneys can stay outside of the body for 36 to 48 hours, so candidates from a wider area can be considered. The organ donation process is different in every situation. It all comes down to whether or not the organ has to be transported from one hospital to another, or if both the donor and recipient are at the same hospital. If both people will be at the same hospital, they will start the surgery on the donor first to take the organ, and then they will start the process of placing the organ into the recipient's body. 2 types of surgery are commonly used for this. The first is open surgery, where they cut the skin, muscle, and tissue, and that usually results in a longer recovery time and more pain. They also do a laparoscopic surgery, which is where the surgeon will make a number of small incisions and remove the organ using scopes. Only a living donor can have a laparoscopic surgery done. This procedure is far less invasive for the person. The recipient's body may reject the organ that is donated, but they have come up with medications to try to help stop that. The recovery process differs from person to person. Typically, a kidney donor can expect to stay in the hospital for 3 to 7 days. Most kidney donors can resume normal activity 4 to 6 weeks after the surgery, depending on the physical demand of their daily tasks. A liver donor may stay in the hospital up to a week, and in some cases even longer. The liver will typically regrow to its normal size within 2 months, although some people it may take more time. Transplant centers are required to report donor follow-up data at 6, 12, and 24 months post-donation. Donors should attend all follow-up appointments to make sure that they are recovering appropriately. I know that I have thrown a lot of information at you, but organ donation is important, and it is something that a person should research and really think about before they decide to do it. Just think, if you could donate one organ, you could save someone's life. The pain and discomfort you would feel for a short period of time could help a person spend more time with their family and be able to achieve their dreams. It could be a mother or a father longing for more time with their children, or a young adult whose life has just started and they are facing the fact that without a transplant their life will be cut short. If becoming a living donor does not sound like it could be something for you, please consider having your organs donated should you pass away. According to DonateLife.net, one person that is a donor could save up to 8 lives. That means you could potentially save multiple lives with your organs.